What's up, y'all? This is Willis with Evo Performance Therapy, and today we're going to be talking about a really common question we get in the clinic when it comes to more of the performance-oriented stuff we work on, and especially with a lot of our folks with back pain, is should I wear a belt when lifting? Okay, there's a lot of things to unpack here. The first place we're going to start is what is bracing? Okay, we need to talk about that a little bit first, and then we'll kind of talk about how the belt fits into that. But some of the common questions we get, things like, is it cheating? Is it going to make my core weak? How often do I need to wear it? Those are some of the more common questions we get around this issue, and we'll touch on some of those kind of towards the end. But again, let's first set the stage with bracing, then we'll talk about where that belt comes in and answer some of those questions at the end. So bracing, why do we need to brace? What does that mean? And then we'll talk about some just visuals on how we do that, okay? So why do we want to brace? Bracing is basically using the combination of creating rigidity and using breath to create what's called intra-abdominal pressure to stabilize our midsection, okay? We want to do that because when we're lifting, let's use a back squat, for example. We've got that bar on our back. I want to be able to transfer that force from my legs as efficiently as possible through my midsection into that bar. I don't want that force to leak out anywhere. I want all that force being transferred into the bar from my legs. One, that's going to increase my performance on that lift. Two, that's going to make sure I keep the structures around my back healthy and safe as I'm moving those more maximal loads, okay? So how do we do that? This is where Dr. Lexi, our pelvic floor specialist, has some more in-depth cueing on some bracing strategies, and you can find those on our Instagram. She's got some great stuff there that can kind of dive a little bit deeper into that. But I want to go with just some analogies here for more of a visual aspect, and then we'll talk about where does the belt fit in. So what we're going to use here is this balloon, okay? And so this balloon represents our abdominal cavity. So on the top, I've got my diaphragm. On the bottom, I have my pelvic floor, and then all around it, I have the muscles of my midsection or my trunk, okay? So let's start with kind of talking about some of the improper ways to brace, and then we'll talk about how we want to set that up. So the biggest thing, again, we're looking for the combination of rigidity from the muscles around the trunk and breath, or getting air into that midsection to create that intra-abdominal pressure or that pressure within the abdomen, okay? So let's pretend this is my abdominal cavity. A strategy a lot of folks will go with is just trying to take in as much air as possible, okay? Now, while that does fill up that cavity a little bit more, obviously I've got this guy sealed off right now, but if I go and blow more air into this balloon, it's gonna expand a little bit, right? It's gonna get bigger, the volume's gonna get bigger, but it's just kind of passively expanding as I breathe into that. It's not necessarily getting a lot more pressure inside of there. So let's now picture that I can change the elastic material this balloon is made out of at this same size. I'll change that into kind of a more firm plastic shell, okay? That is what I'm gonna do by using the muscles around my midsection to create rigidity and set the stage for where we want to go next, which is now adding the breath, okay? So I've made this elastic more into kind of a hard plastic by creating tension with my muscles around the midsection. Now let me try to add air into this, and as I do that, that hard plastic shell isn't going to want to just passively expand as much. It's probably going to expand a little bit, but as we put air into that rigid system, that's what builds that pressure inside of there more versus just getting it as big as possible, okay? So that's kind of the visual we want to look for when we're setting up our brace, is create rigidity, then add the breath, okay? That helps us create a lot of that intra-abdominal pressure and sets us up for really strong lifts and good positions, okay? So where does the belt come in? The biggest takeaway for this whole discussion is the belt is there to supplement your brace, not to create it, okay? So let's go back to the balloon analogy. Let's go back and start with the more improper version of what we want to do, and then we'll move to kind of the ideal technique. So again, I've got this balloon. It's back to just that like normal balloon elastic. I put that belt around there and I cinch it down like this, okay? You can already see that I'm starting to leak a little bit of force kind of out the top and the bottom. You might even see this if you have somebody that cranks their belt down a whole lot. Not that this is an exact representation, but when they go to try to breathe in and that belt's just cranked down to the max, you see that their gut kind of expand on either side, it's just kind of spilling over, and they're having a hard time creating that tension, okay? So what we want to do let's set the stage first with the analogy we talked about. So let's make this outer shell more rigid. Let's put that belt around there to give us a little bit of extra support through there. Now let's breathe into that. That belt basically just helps reinforce the brace and rigidity we've already done. Now we breathe into that. That just helps us build that extra little bit of pressure inside the system. Again, we should have already done that on our own. The belt's just there to give us maybe that additional 1 or 2% there to help out, okay? So let's talk about some different types of belts. The type of belt you want to use is dependent really to your preference. A lot of folks prefer using one belt across the board. Some people like different types for different lifts. Just some common examples of the ones we typically see. Usually the two main variants you're going to see are this kind of more fabric Velcro type belt, easily adjustable, not super stiff, but can still give you a little bit of that support around the midsection. A lot of folks like these for their Olympic lifts, but by all means they can still be used on the heavier lifts like the squat and the deadlift. Or the typically more other common type we see is a leather belt. This is going to be a little bit stiffer than that fabric material. It takes just a little bit more effort to adjust, but there are other versions of this besides the prong version. There's lever versions that are easily adjustable. You can take it off and on really quick. And like I said, this just comes down to preference. If you like using this type for all your lifts, that's great. If you like using this for Olympic lifts, this for your heavier lifts like your squat and your deadlift, that's totally fine as long as we're using it like the way we just discussed. So what are some of the other commonly asked questions we get? We touched on it a little bit, but how tight should I wear my belt? It should be tight enough to give us some support and feedback, but not so tight that we can't do our brace like we want to, okay? So if you crank that belt down and you're having trouble getting that rigidity, or even you can't really even get a full breath in, the belt's probably too tight, okay? We're probably relying on it to create that tension and not doing that ourselves. So usually a good rule of thumb is once you get that belt cinched down, you should relatively easily be able to get 2 fingers in between you and the belt, okay? Next question, is it gonna make my core weak? Well, assuming we're setting the stage by bracing on our own and letting the belt help out, no, it shouldn't make our core weak. Not to say we should use the belt all the time and you're good to use it the second you start picking up weights. That's kind of the next topic we get into is how often should I train without a belt, or at what weight should I start using my belt? If you find that, you're not even getting up to 50% of your 1 rep max on whatever lift it may be, and you feel like you got to throw that belt on, or let's say we're in CrossFit class, we've got a Metcon with some relatively light front squats or thrusters, whatever it may be, and you feel like, oh, I got to make sure I have my belt on for this. We might need to dive a little bit deeper into why you feel like you need that, analyze what kind of strategies you're using for bracing, and see what we can kind of figure out there. Again, the belt should be there to help out when we need it, and ideally that is kind of those scenarios where we're moving more maximal loads, whether that's 1 rep maxes or just some more challenging rep sets. No hard number here, but typically a good idea is probably save that belt for at least somewhere above the 80% range. If you feel like you're having a lot of trouble and you can't get anywhere close to that before like you need that belt, or you feel like your form starts breaking down because you just don't feel strong through there, we probably need to analyze those bracing strategies and work on that a little bit. That's a great strategy a lot of folks will use to supplement their training, is doing some intentional periods of training without a belt to practice developing that brace on their own under those heavier loads. And then when we go back into training with the belt, we're that much more solid when we go to add it in. So the short answer to all of this is yes, absolutely. You should wear a weightlifting belt. It's great for enhancing performance and can help you hit those heavier lifts in the gym, but we need to set the stage first with what we're doing, then add the belt on top of that. So if you have other questions, whether it's performance related, rehab, any other things about equipment when lifting, let us know. Drop us a DM on Instagram. We'd be happy to answer any questions you may have. But other than that, train hard, stay healthy. We'll see y'all soon.